Hi, this is Joe Firestone. I'm your host for Progressive Short Takes. And this short take is about stopping Biden from using lobbyists to write his plans and legislation. Not only stopping Biden, but stopping Congress as well. Anyway, let me stop sharing the screen with that one and skip to a post by Dave Sirota, which deals with a great example. I'm sorry, this was actually on Dave Sirota's, his blog, the Daily Poster, but this one was written by Andrew Perez and Julia Rock. So I'll have to change my description later after we get off here to give them the proper credit. They wrote this on January 19th. There's a picture of Joe in front of a flag, Joe Biden. President-elect Joe Biden's new COVID relief plan does not adopt existing Democratic legislation to expand government-sponsored medical coverage, nor does it propose a promised health insurance public option. Instead, it adopts proposals from health insurance lobbying groups. Recent letter to lawmakers demanding the lucrative new subsidies for insurance companies at a moment when those corporations have recorded record profits as millions lose coverage and many face claims denials. Biden's plan would shovel billions of dollars to private health insurers by providing subsidies for Americans to buy coverage through the Affordable Care Act marketplaces, which are far more expensive than government health care programs, have at times been plagued by high rates of claim denials. The plan would also subsidize COVID continuation coverage through September, allowing workers to keep their employer health insurance plans when they're laid off. But COBRA is so very, very expensive, though. Anyway, going on. Those initiatives, which could further boost insurers' skyrocketing profits, were recently recommended in a letter to lawmakers from AHIP, which is America's Health Insurance Plans, and the Blue Cross Blue Shield Association, two insurance lobby groups in Washington that have opposed the expansion of government-sponsored healthcare programs. A few days after the letter was written, AHIP said that, quote, health insurance providers are eager to assist the Biden health team, unquote. Sure they are. Biden's inaugural committee has received donations from at least two major health insurers, Anthem and Centene, which both offer plans on state, but plans on state marketplace exchanges. Centene's CEO bundled donations for Biden's presidential campaign. Biden's first major campaign fundraiser was headlined by Independence Blue Cross's CEO. During the 2020 primary campaign, Biden repeatedly demonized Medicare for All bills offered by Representative Pramila Jayapal, Senator Bernie Sanders, questioning how the country would pay for it and proposing a public health insurance option people can buy into instead. But Democrats previously considered creating a public option during the ACA negotiations a decade ago. AHIP secretly bankrolled a successful $100 million advocacy campaign to kill it, while Medicare for All could save the country up to $650 billion annually. I have to, they say, okay, according to the nonpartisan CBO, okay, so I have to strenuously protest, okay, against that. Yes, according to the nonpartisan CBO, but the nonpartisan CBO is not nonpartisan. Maybe nonpartisan between the Republicans, okay, and Democrats, but it is not nonpartisan from the standpoint of favoring corporate interests versus the interests, okay, of the American people. It is not nonpartisan with respect to that, okay, at all. It is thoroughly filled with people who are corporate sympathizers, and it is run by people who are neoliberals and who have been neoliberals since the first time CBO opened in 1974, when the original director, okay, was Alice Rivlin. It has been neoliberal since that time, without change, without relief, all these years, and it's been one of the most instrumental agencies in allowing neoliberal policies to dominate our fiscal policy here in the United States. I strenuously object to the $650 billion annually savings. All you have to do to dispute that is to look, okay, at other nations that have Medicare for All and ask yourself, what percent of GDP are those nations actually spending? Canada, the nation most like us in the world, is spending 11% of its GDP on healthcare spending. We spend 18% of our GDP. We have a right to expect that if we implemented a Medicare for All program, the specific legislation, okay, of Jayapal, we have a right to expect we would soon get to Canada's level or even lower than that in terms of spending as a percent, okay, of GDP. What kind of saving is that? 7%, okay, of GDP is roughly $1.6 trillion a year right now. We would be saving $1.6 trillion annually and $16 trillion over 10 years. Okay. So I wish progressive people would stop citing CBO. They think it's impressive because they think even CBO, this awful organization, thinks we could save $650 billion annually. That's still $1 trillion off per year what we would actually save. It's more important to make that clear to the American people than to try to get a safe estimate from the very partisan CBO. Anyway, Biden is now proposing some of the most costly and inefficient ways to expand health insurance coverage, which is true. The moves could still leave people exposed to substantial out-of-pocket costs from deductibles, copays, and coinsurance that act as barriers to care and that add to national health care expenditures. The objective here is to save the country on national health care spending. It is not to save the government on its expenditures. The public purpose is saving the people from having to spend that particular portion of national spending on health care, because we could spend it on other things if we could save that and still cover everybody and save the lives involved in that. Anyway, they go on. Pushing people onto ACA plans and subsidizing COBRA coverage would be expensive, but not necessarily popular. Healthcare coverage purchased through the ACA marketplace costs 83% more than Medicaid coverage, and ACA plans leave patients with 10 times the amount of out-of-pocket costs, according to a recent study published in the Journal of the American Medical Association. The researchers concluded that marketplace plans cost so much more than Medicaid because private insurers pay higher prices for the same services, quote unquote. Hospitals are often bill people with employer health insurance plans, which are maintained under COBRA, more than twice as much as those with Medicare or Medicaid. The Biden proposal does include a measure to slightly lower the percentage of Americans' annual incomes that insurers can collect through premiums, from a minimum of 9.86 to 8.5%, 9.86% to 8.5%. Altogether, the Biden transition says its plan, quote, would reduce premiums for more than 10 million people and reduce the ranks of the uninsured by millions more, unquote. The ACA marketplace was a centerpiece of Dems' 2010 healthcare reform law, but only a small slice of Americans are actually buying insurance plans this way now, often people who are self-employed, independent contractors, or gig workers. The ACA exchanges are only currently, quote, a minuscule part of the health insurance system, the People's Policy Project wrote last month. While the marketplace was billed as allowing people to shop for health insurances, in reality, the state exchanges offer few choices, and most are expensive. The average lowest cost premium for bronze-level plans is $321 per month this year, though the numbers vary widely by state. The premiums are pricey, but an even bigger issue is the nightmarish deductibles people with ACA plans are expected to pay before their insurance company actually starts footing their medical bills. The average bronze plan deductible on the individual market was nearly $5,900 in 2019. But deductibles are lower on silver and gold tier plans, but the average lowest cost monthly premiums this year are $436 for silver plans and $482 for gold plans. But poor employees may qualify for subsidized premiums or cost-sharing reductions, limiting their maximum out-of-pocket expenses, but those reduced out-of-pocket maximums are still substantial. The article goes on in this vein. It points out that a further lobby group, the Partnership for America's Healthcare Future, spent $4.5 million on advertisements that were attacking Medicare for All. Now, the group launched a late wave of ads in South Carolina, where Biden's strong performance helped to propel him to victories around the country. So they directly intervened in a primary election, spending $4.5 million free advertising for Joe Biden. Corruption, right? PAHCF's tax return shows it is steered by executives from AHAP and lobbying groups of pharmaceutical companies and investor-owned hospitals. The industry group raised more than $55 million in 2019, and it has made clear it would fight against the federal public option plan, just as AHIP did in 2009 and 2010. It has also spent millions of dollars in 2020 to block a state-level public option in Colorado. Not even Medicare for All, just a public option. Biden consistently campaigned in support of a public health insurance option. After the primary, a joint task force made up of Biden and Sanders' allies settled on a fairly robust public option plan. And the task force wrote, quote, The public option will provide at least one plan choice without the deductibles. Will be administered by the traditional Medicare program, not private companies. Will cover all primary care without any co-payments and control costs for other treatments, paid by negotiating prices with doctors and hospitals, just like the Medicare program does on behalf of older people, unquote. And the DNC's platform included a similar pledge. But now, on the eve of his presidency, Biden is proposing a much more conservative health insurance expansion plan proposed by the health insurance industries. If enacted, the plan could head off any talk in Washington of a public option plan down the road. Now, I'm not coming out for a public option plan. I previously have had a live stream on why the public option is a trick sparkle pony that doesn't work. I criticized Bernie Sanders back in something like, I think it was 2016 or 2017, for beginning to tread down the public option trick sparkle pony road. So I'm not for a public option. But the point is, Biden would not even have that. The insurance companies would even have that, even though a public option would be doomed to fail if the insurance companies were in a position to compete with it. There are many other options available. Democratic lawmakers could choose to rally around existing legislation to enact an emergency Medicare for All program, or they could press for a public option as the party and its incoming president has promised. Again, I'm not for that, but they could do it. It would be better than what they are doing. Biden could use his executive authority to expand Medicare during the pandemic, using emergency provisions in the Affordable Care Act. Democrats could also seek to expand Medicaid to cover more people. Instead, Biden is pushing a health insurance expansion that would further enrich insurers and put people on insurance plans that will be for many of them to use. The Democrats should reject this insurance industry cash grab. They should. And Biden should reject it too, and he should quit having the industry lobby writing his plans for him, as should the Democrats in Congress. We've had enough of that. It was the industry lobbies that wrote the Affordable Care Act in the first place, and that doomed consideration of Medicare for All back in 2009. It's enough. We've had enough of that. The murderers by spreadsheet have to be disempowered. Their power has to be taken away from them. They should not be allowed to donate to political campaigns. If there's any corporations, and I think all of them actually fit, but any corporations that should be prohibited from donating to political campaigns, it's those in the healthcare industry, because the impact of their lobbying has been to kill people year after year. I created some estimates, which are again on my personal blog, not but too many years ago, concerning what the cost was in American lives between 2010 through 2016 for not passing a Medicare for All bill in 2009. That cost estimate in lives came up to 356,000 people who died unnecessarily because they did not have health insurance because of the failures of the Obama-Biden administration. We cannot have that sort of thing happening again. Thank you very much for coming. That's it for this progressive short take. Okay, I hope you liked it. Hi, Deborah. Hi, Dolores. Hi, Kay. I guess there are 10 people out there. I haven't seen too many comments telling me there are 10 people there. Anyway, this was the shortest of the short takes today. Okay, I'm done with this one. I'll try to come back with some more later, but I may not have a chance until tomorrow. Anyway, thank you for coming. Dale Weaver says, love it. Loved it. Thank you, Dale. glad you're here. I'm glad you loved it. Anyway, have a good evening. I'll be back later with the In-Depth show at 9, of course. Bye-bye.